He said to me, and I quote, "Would you be okay with a medical doctor shadowing the treatment for your study?" This was the first kind of like initial conversations, and I was like, oh my God, don't do that. Breathe. And I sent him a whole bunch of research about the safety of chiropractic, because that's what he was worried about. He was like, no, you need, to make sure that this is safe and you're not harming the babies. I sent him a whole lot of research. I sent him the Safer Care Victoria data. Thank you to that Victorian Health Minister. And he was like, okay, that's fine. We don't need one then. It sounds good. And we have a project happening. So thank you, Angus. He has no idea. And that was in, where are we now? 2024 I started, so I'm already 2 years into the PhD. And it's been quite a hard journey just to get this far, but we got there. The project that I landed on was because of Jasper. So initially I said I wanted to do the prem babies. After multiple conversations with these supervisors, they were like, I don't think we can start with prem babies. It's like the first ever research we're doing on babies in chiropractic. We're not going to start with prem babies. They're never going to let you do that. Let's wind it back a little bit. And something that he kept saying to me was, but how does it work? Like, what are you doing with these babies and how does it work? Because I had managed to convince him that we're not cracking their necks. And so he was like, okay, but what are you doing then and how does it work? And that was a good question, because I know the science very well. I know all of the research that we've done at the college. I know how to explain what that is in adults. And I was like, we think it's this, and this, but we're not sure. And he's like, well, then you need to find out. So that's part of the project that I'm doing. And then the other part was, we decided to have another baby, because if I'm studying, then I should be having another baby, apparently. And we're in the middle of COVID. He was born in February 2022. So I was pregnant in 2021. And Auckland during COVID was a nightmare. We were so locked down, very heavily restricted. You weren't allowed to talk to your neighbours. Your neighbours would dob you in if you talked to them. Chiropractors were not allowed to practice. We were not deemed essential. Everyone was out of work. Okay, and this was months. Then we managed to get the essential status and we got back to practicing, and then they brought in the vaccine mandates and said, if you don't have this, you can't practice. And it's governed by the legislation. They cracked down on us very hard. I am 6 months pregnant. My husband is a chiropractor in practice, and we are staring down a barrel of losing our job, losing the ability to provide the care that we love, and I'm pregnant, and we have 2 other children. Lucky for me, I was teaching as well at the college at this time, and so I had that to fall back on. But then I was pregnant. And I do really very much believe that Jasper came along at the perfect time, because it was an easy way for me to I'm going on maternity leave, I'm not working anymore. I kind of had a little bit of a buffer there of no, get that poison away from me. But I was very, very stressed.